On Saturday, September 6, the Medical and Dental Council Conference united local and international health professionals for an in-depth look at one of modern medicine's most transformative tools, MRI diagnostic technology. Beyond professional exchange, the conference also served as an educational platform, underscoring how this advanced equipment is set to transform patient care and diagnosis in St. Lucia. Offering further perspective, Dr. Donny Glasgow, Medical Director of La Clinique du Corps, shared insights on the MRI technology now available on island.
Today marks a very important day for medicine in St. Lucia. At La Clinique du Corps, we've brought in the new technology that you'd have heard about over the past year or so, that we have a brand new General Electric 1.5 Tesla MRI here. We've basically moved from a stone age in MRI technology, or not having it at all, it not being existent in St. Lucia, to having what is found in what is considered first world healthcare.
Dr. Ashish Jerath, a radiologist in Canada and presenter at the conference, provided insight on the equipment and the significance of the conference in educating various medical practitioners on the new MRI technology available.
We have received one of the top-of-the-line MRI machines pretty much in the Caribbean and comparable to a lot of machines that are old in the USA and Canada. And I'm here to talk about whole body MRI and the positive benefits of scanning the entire body using this new radiation-free technology, and how many diseases can be picked up early, how many conditions can be managed in a different way. This is a new emerging technology, and St. Lucia is very blessed to have this machine here. You can find so much information that is missed in other technologies, and in the end of the day, this makes the patient's care better. People who need to get repeated scans, especially if you're getting a CT repeatedly, you're getting a lot of radiation. But now with the power of MRI, we can get the same amount of imaging and more detail without radiation.
Colombian radiologist Dr. Catalina Valencia, who presented on the use of MRIs in everyday clinical practice, underscored the importance of this new technology.
The MRIs are play a really important role in the diagnosis of, as I said, certain medical conditions, but they are also going to individualize management, and I think that's a crucial role they play in everyday practice, because it's not the same to have a tumor diagnosed by CT, which you could only say this is a tumor, a neoplastic lesion, but to have it characterized by MRI, because MRI is going to give you a name and a last name for that tumor. So you could say this is a low-grade glioma, for example, and that will change and individualize the treatment that patient is going to go from now on. So all that happens in every condition that we evaluate with MRI.
Dr. Glasgow emphasized the value of making MRI technology accessible to St. Lucians, noting that such advanced diagnostics were once limited to developed countries.
More than a year ago, to get an MRI, we would definitely have to travel from St. Lucia. That is not necessary anymore. We have the latest of technology, even the most advanced machine in our region. And again, it is a similar machine that you'd find in what we'd consider first world countries or advanced healthcare systems. So in terms of our capabilities here, especially for MRI, we are way up there in the world. And this in itself, it changes quite a bit. I cannot even express how much of a game changer that this is in diagnostics for St. Lucia.
For Choice News Now, I am Dyrud Lionel.